Hello everyone, I Bhuvaneshwari of PharmD from Geetanjali College of Pharmacy. Today we are going to learn regarding amoebic meningitis. As we heard the news of Kerala, a 14-year-old boy affected with the disease. This is the fourth case of rare brain infection. Among 4 children, 3 of them are died. The amoebas can enter the brain through the nose when people swim in contaminated water. Thus it leads to primary amoebic meningoencephalitis. It can progress very rapidly. The main objectives of the session include introduction, etiology, pathophysiology, clinical manifestations, diagnosis, treatment, and then the prevention. Now let us discuss about the case. Amoebic meningitis, also called as amoebic meningoencephalitis, it is a very serious illness. It causes inflammation of the brain, and Amoeba Naegleria fowleri causes primary amoebic meningoencephalitis. The amoebas live in fresh water. It is exceptionally rare and highly lethal to central nervous system, caused by free-living amoeba found in the fresh water. These are broadly classified into two types: primary amoebic meningitis and granulomatous amoebic meningitis. Etiology of the disease includes primary amoebic meningoencephalitis is a rare brain infection caused by Naegleria fowleri. It is a free-living amoeba. Amoeba is too small, we cannot see with our naked eye. It leads to severe complications. The complications of the disease includes death usually occurs within 5 days as symptoms appears. Pathophysiology of the disease includes generally in humans, Naegleria fowleri can invade the central nervous system via the nose to the olfactory mucosa. The penetration initially results in significant necrosis of the hemorrhage in the olfactory bulbs. From there, amoeba climbs along the nerve fibers through the floor of the cranium and thereby it enters into the brain. Once amoeba enters into the body, the amoeba travels to the brain where it destroys the brain tissue and causes the swelling. As primary amoebic meningitis is non-communicable disease, most people with primary amoebic meningitis die within 18 days. The people die as the symptoms appears. It is a syndrome affecting to the central nervous system, most frequently in the children or the young adults. Signs and symptoms which includes headache, fever, nausea, vomiting, stiff neck, sore throat, change in the smell or taste, loss of balance. How to diagnose the disease? Let us see. We can diagnose the disease by CT scan, MRI, polymerase chain reaction test that detects Naegleria fowleri in patients with cerebrospinal fluid or the tissue of the brain. Early diagnosis treatment can lead to survival of patients with primary amoebic meningitis. Incubation period for primary amoebic meningitis ranges from 5 to 7 days of the duration. We can cure the disease by taking the medication like amphotericin B 1.5 mg per kg per day intravenously in 2 divided doses for 3 days, then 1 mg per kg per day for 11 days, and amphotericin B 1.5 mg intrathecal daily for 2 days, then 1 mg per kg per day every 48 hours for the next 8 days. We can prevent the disease by taking certain measures which includes don't jump into warm fresh water or thermal pools. Keep your head above water in thermal pools and warm fresh water. Make sure swimming pools are chlorinated. Use boiled, filtered or sterile water for nasal or sinus irrigation, not with the tap water. Don't dig into or stir up the sediment at the bottom of the shallow bodies of the warm fresh water. These are the measures to be taken to prevent the disease. These are the references to know more information regarding the topic. Thank you everyone. I hope this video is useful to you to prevent the amoebic meningitis further.